Hi everyone, welcome to my live session. I'm Dr.RakheeYadav, consultant pediatrician, and today's topic is the aches and pains from prolonged working or prolonged classes at home. And I have with me a special guest, Dr. Sanjiv Rampal, who is a consultant orthopedic and traumatology surgeon. Just give me a minute. Hi, Dr. Sanjiv. Let me just add you in. Hi, Dr. Sanjiv.
Hi, Rakhee.
I'm going to need you to turn the camera so that we can see you face up. Yeah. Yes. Yeah. Down a bit. Yes. All right. Thank you so much. Hi, Akash. Hello. All right. Thank you so much, Dr. Sanjiv, for joining us live. I know we were supposed to go on live at 8 p.m., but a couple of things came up, and thank you so much for adjusting the time. I was just introducing you as a consultant orthopedic and traumatology surgeon. Would you like to tell us a little bit about yourself?
Yep. Thank you so much, Rakhee, for inviting me and hosting me today. I'm Dr. Sanjiv Rampal. I'm an orthopedic consultant based in a local university and also in a few centers in KL. Today we'll be talking about the common occurrences of aches and pains during the pandemic and during the frequent injuries that we encounter. Now, as you know, we're going through a lockdown right now, and this kind of injuries are becoming more common. And so we wanted to have this session so we can share a little bit about what exactly is it, how do we treat it, and more importantly is how do we prevent it. And then I'm going to go a little bit about does it occur in children, and a little bit about the tendonitis, which I will talk about a little bit soon.
Excellent.
So,
Thank you. Thank you so much for bringing up the agenda. Thank you so much.
I'd like to wait for a couple of minutes so we can get everyone on board because I think probably.
No, I think we'll go ahead because what I do is I save it on IGTV as well. So there's no unnecessary pauses between the videos. So if anybody misses out the first part, they can always just rewatch the IGTV or the video on my YouTube channel. So go ahead, no problem. I'm going to straight away get into it, Dr. Sanjiv. What are some of the injuries that you see from prolonged sitting or prolonged, in one position due to the online working and online classes at the moment?
Yep. So we'll just go ahead and divide it into two of the common occurrences in two work related situations where you have adults in the computer industry, and also people who are now we are doing work from home. So everyone's basically doing a virtual talks and getting work done from home. So it's increased the usage of technology and also the usage of computers and gadgets as a whole at home. And this has increased the number of injuries or number of occurrences or complaints that has been coming in. So and then another one is when you see them in ordinary day-to-day patients who come in for this kind of injuries. So basically, now with the current use of increased use of computer gadgets and social media, we are basically using a lot more handheld devices and also computers and also different types of gadgets which require you to be engaged or expose yourself to abnormal gaits and abnormal positions and postures, especially affecting the neck positions and also the back, the lower back, and also your hamstrings and also your knees and your hips, which will go in more detail very soon. As you may not know, that there's more than 60% of people who are involved with the IT industry expose themselves to more than 6 hours to 8 hours on a daily basis. So this prolonged situation where you have a different increase in demand and also sitting in positions and repetitive movements in specific positions will increase the likeliness of you or the patient getting injured, and also especially in patients who are sitting for a prolonged duration, and then they are expected to get up and stretch and do other things, or maybe conduct or do some things with their hands, and which involves carrying weights. And these weights carried in the wrong position will actually predispose them to repetitive injuries. So the common injuries that we see that occurs in certain of this in this kind of patients are usually hand injuries, tendinopathies, numbness, tingling sensation, all the way to psychological involvement where they are undergoing stress, where they feel like as though they're having tendon or nerve pain, numbness, tingling sensation, pain in abnormal positions, and especially on weight-bearing positions where you see on the wrist, just below the wrist, and also on the elbows, and especially not central spine pain, but more of outer part of pain, where you have the bigger muscles like the trapezius of the shoulder and the lower back. So now, regarding these are the common types, and we will address how do we go about treating them. Yeah. So
Absolutely, yeah. So you mentioned that there are many injuries that we can have, all the way from head, neck, shoulders, back, as well as even wrist and fingers as well, because of wrong posturing, repetitive injuries.
Yeah, from papers, from reports, clinical case reports, especially from the US, Columbia University, and also in other Scandinavian countries, have reported the most region that is affected in the body is usually the neck, and second only
Okay.
by the hand, and also low back pain. So this has become,
okay,
in the orthopedic,
yeah,
has become only second to low back pain related job related injuries, or injuries associated with increased workload, especially when using technology and handphones. Yeah.
absolutely. So what can we do to prevent these injuries from occurring?
So that's a good question. And how we're going to treat these patients is first to isolate the problem and to identify the problem. We have numerous ways that we deal with it, depending on the severity. And we also must not rule out this, Dr. Rakhee, that there's a certain part of psychological effect of these patients being, having increased stress, increased workloads, and abnormal environments, work environments, will predispose them to sensation of pain at different ways. So now, first, dealing with the pain is usually they benefit from stretching, from isolating the pain, finding the cause of it that may or may not require a radiograph, that's an X-ray or MRI, but it all depend on the main symptoms. So if I would consider the most common problem would be the nerve numbness of the hand, where they say that they use too much of flexion or extension of the wrist when they're using computers. So this is a common occurrences where they have numbness on the outer part of their fingers, and it's elevated or it's reduced by them stopping that stimulation, or the occurrences of the injury. So what can we do about it? Basically, we prevent the problem. Activity, it goes to ergonomics, about how we deal with the problem as a human. We see a stress, and we have to think about what we're doing and try to avoid certain positions and certain postures. That's one. Two, low back pain, because I have the habit too of slouching when dealing with computers, and this will almost help tremendously if you put a pillow at the back of your lower back, and this will make sure that you have proper posture, right? And this will reduce the overuse of your lower back. And now there's a certain ways of prevention, but we'll go to that a little later. But how do we treat it? So basically, we give a course of, I would suggest my patients always to take it step by step. First, stretching. Second, stop the activity that's causing the pain. If you're using too much flexion or too much of extension, stop that. Another thing that would be good to be using a brace, maintaining the wrist at neutral positions as much as possible. The Scandinavians have come up with a program that has increased the way we treat, has increased the success rate of how we treat these patients, and that's called the stretch program, where they have a meter, they have just a meter or a reminder on the computer that states after 15 minutes, or nowadays we have the Fitbit and we have the Apple phone that reminds you to get up and stretch and move a little bit, and this helps. In certain papers reported in numerous countries say that this helps and this prevents future problems and decreasing your likelihood of getting an injury. Besides that, now treatment would also involve massages, therapies like traditional medicine like acupuncture, but that's about the only thing that I would suggest about traditional medicine, nothing else. Besides that, stretching, creams, plasters, over-the-counter medications like non-steroidal anti-inflammatories that will need a prescription and would need you to see a trained medical personnel would be a good idea. And also a brace would help. And just doing simple methods of avoidance. Yeah.
All right. So basically, to recap, you're saying, first of all, see a medical practitioner, preferably an orthopedic surgeon, so that you can actually get a diagnosis done, which part of your body is actually having the issue. Once you've got a proper diagnosis, then you can actually include physiotherapy or traditional medicine or some medication that could be prescribed by the doctor or the medical practitioner itself. So basically, this is the gist of treatment, but make sure, I like what you said about getting up after a while and making sure that you move about. So I was just going to ask you, is there any particular timing that, we should get up and, is it every hour get up for 10 minutes, or is it, every 2 hours? How long are we allowed to sit?
It's actually a habit. It's ergonomics, but it's actually developed by a set program, and this was proven to decrease the likeliness of injury to patients who are work related, and especially exposure of more than 8 hours of patients in using a certain posture. So, but basically, this program encourages you to move every 20 to 30 minutes. You have a timer, and it helps you stretch and walk, and this will get the muscles involved and also prevent further injuries and stiffness and pain. Yeah.
Excellent. So are there any other ways that we can do to prevent us from getting injured? Like you mentioned ergonomics, so those ergonomic chairs and tables, but are there any other ways that we can do?
Yeah. That's so true. And now prevention is better than cure, as usual, and as you all know. So I think I would profess prevention. Even it reduces your chances of having an injury by a lot. Yeah. So the first thing to do is to maintain eye level, maintain a good eye level, the same way as same position of where your computer or your method of choice of using technology. Either it's standing, sitting up straight. Your posture is very important. So now, if you have a choice of using your computer at the same level of your eye, or higher or lower, you should prefer something at this exact same eye level or something lower. So you have those computer tables that make you see through the screen and makes you bend lower. But this is also a work in progress, and they say that just prevent yourself from extending your neck or lowering your neck, and you should be the same level. That's one. Two, prevent slouching posture, sitting upright, putting a small pillow at the back of your lumbar, over the lumbar. You have those cushions that you can get it online that are relatively cheap and prevents a lot of problems and prevents the strain of your lower back. Besides that, a proper position of your keyboard, a proper position of your mouse, prevent flexion of your wrist or extension of your wrist, right? Or putting a weight or something that hinges on your wrist, especially here, what you call the ulnar styloid, or the dimple that you have on the inner side of your wrist. So try not to aggravate that, or the elbow. So now all of these methods, the stretch method was another method that was a breakthrough that helped a lot of our patients deal with this. Also using a footrest. When you're actually typing or stuff, you can actually use a proper footrest. And also we encourage people, even children and in school, in teachers, we encourage them to have a proper workstation where it's actually made for us to work, and not because at the moment everyone's working from home, which is an environment which is quite challenging, which is not made for us to actually work. And if you are using this methods or this inadequate equipment, it's going to cause you to have pain, and also have you increase your chances of getting an injury. So prevention is better than cure. Use a brace. Also use a brace. Maintain it at straight level. I wouldn't suggest a compressive one as much, but try to maintain it as straight as you can. That's one. And do stretches every 30 minutes. Try to avoid screen time, as use it only if you have to, and try not to sit in positions. There's also a paper that demonstrates the use of a phone, that you kind of bend your neck towards, and you kind of hinge your neck and your shoulder with your ear, and that was proven to be a strain to your muscles of the neck. So I would suggest not for that, and a brace, stretching, and all of this, and a proper chair, proper table, proper workstation would go wonders. And now they have made movements in work, and occupational therapists have gone into the workstations, and they're promoting all these ergometrics that help prevent this kind of injuries to happen. Yeah.
Wonderful. Wonderful. So now my next question would be, because I've got 4 kids. So what about, I mean, you've mentioned a lot of things that adults go through in terms of workstations and things about that, but children now have to do online classes. So is there a difference between the issues that are being faced by adults, in the sense that due to prolonged working, and children who are having online classes and school that is online? So is there a difference between the children and the adult in terms of the injuries that they sustain?
Yeah, this is a fantastic question that has been brought up quite a few times in my practice too, where the parents are becoming more cautious about what's going on, and obviously they're trying to prevent injuries to the children or their loved ones. So yeah, interestingly, they have a few papers that have come out. Mainly, as I said before, there was 2 papers, one from Columbia University that investigated the occurrences of, or the most common common complaints of children being exposed to online teaching and online sitting, using video games as a method of teaching. And they showed by far the most biggest complaint was actually the neck region. And these are in children, the more elder children, and also interestingly, more boys than girls actually complained about this, which was interesting to look into it. And so the methods, that was one. And there was another one that investigated the factors that actually, how much weight that you can carry as a child above or away from the body. And this was done in the University of South Korea. And they investigated close to 30 students, and they measured the angle of the neck, they measured the angle of the hip, and to the thigh, and they discovered that exposure of more than 30 minutes or more than one kilogram away from the body would have a strain on the children. Yeah. So now, how to prevent it will be a good way. And now they have movements in America which promote good ergometrics for children, especially having. It all goes back again to the same prevention. The first thing we have to educate is the teachers and the parents about ergometrics, about having proper workstation. That means a proper chair, a proper table that has the height and the proper, trying to maintain a good eye level, preventing of neck straining, more than whatever that's required. Also, there's also been increase in complaints about thumbs and also of the hands in children. But this was limited in the US. What they promote is not to overexpose them, try to take short breaks in between, make them move, and the stretch program. So this has actually been taken up by the U.S. education system, which I think needs to be brought to highlight in the Malaysian healthcare system, and also eventually to the healthcare and the education system in our country.
Wonderful, excellent. So basically, ergonomics plays a huge role.
Yeah.
What about those, you can buy those online things where the computer goes upwards, so you're facing that. So is that something that you would recommend? Because it's now at eye level.
Yeah, as long as it's eye level, or you are kind of bending down, that would be prepared to above. And children, when it comes to children, I think the most important thing is having proper workstation, and this has to be translated into patient education. The parents have to be educated. So the teachers involved with the education system would need to change. But yeah, those are the things that are affected. There's a nice paper about injuries of the thumb when they were using Nintendo games, and it was called itis, and it was reported out of the U.S. and they encourage. They had increased patients who came with injuries or complaints of hand disorders because of the release of a certain brand or a certain game. There was and it was a nice way to address the problem and highlight that children are also affected by this, by increased time that we spend online, and prevention is better than cure. And I think it's good that you highlighted this problem in children, because I think it kind of gets swept under the carpet, because there's not many people that actually end up coming to see a professional medical personnel for this kind of problem.
Yeah.
Yeah.
Absolutely. Yeah. So like initially when the pandemic started, all of us were just like sitting on the dining table. Let's just sit, on the sofa, wherever there was a phone, because we didn't think this was going to be something long term.
Yeah.
But then now we've moved on. We're almost 2 years into the same pandemic, and online classes have been on, off. And even working from home has been like, on, off. So I think it's very important, like you said, to have a proper workstation and not just sit on your dining table, even though that might be the most convenient. So and interesting that you mentioned the thumb injury. I actually had a patient the other day who came with hand pain, and it was because of online classes. And then I had another patient who had she was lying down, so she lies down and she her neck is forward and she's on her iPad.
Yeah.
So she had severe neck pain, which presented as a migraine.
Yep.
So she came and saw me as a pediatrician, because she's like, I think my child is developing, the mother is very concerned, my child is developing a migraine. And when I took the history and all, and I found out that she was actually doing this very often, so it could have been actually the neck sprain that worsened and caused, so basically one injury may propensate and become other injuries as well. So it's not just one problem per se. So it's very important to seek the right treatment when you find something wrong, especially with all these wrong postures and prolonged sitting and all. So I absolutely agree with you. What about any last messages you have, Dr. Sanjiv?
I think, Dr. Rakhee, you also, we in the health system, we kind of forget the effect of psychology on this kind of injuries. Mental health is a very serious matter, and it needs to be addressed. And in the Malaysian system, it's been addressed, but maybe psychological effect of the pandemic has made patients of all ages come to us for numerous pains that sometimes cannot be does not relate to an actual injury. And this may be one of the things that you saw with the kid. So sometimes people, as human, you react differently to different stimuli and different stress. Especially I see it in the adults, where my patients are complaining of the exacerbation of awkward pains and injuries that don't relate technically to an injury of the muscle or also the nerve. So yeah, psychology is very important. I often try to address the problem by giving them reassurance and prevention methods, and if needed, I would refer them to professional help by a psychologist. Yeah. And another thing that I wanted to highlight over here is, which I've been getting a couple of patients of late, is the occurrences of weekend warrior, where they sit at home and they work for prolonged durations of time, and then they see the Euro finals going on, and they think they're Ronaldo or Cristiano Ronaldo, or they are the next Messi, and they go out and they injure themselves. So I had a patient who was just like. Just he ran, like he just went jogging after like 2 months of a lockdown, and he couldn't move, he couldn't walk after that because he had injuries of the muscle strain. So do stretch, and stretching is very important, and try not to be a weekend warrior. Stretch before, and try to limit have limits at your exposure of physical exposure. Maybe go 10 minutes and then work on the next day a little bit more, and not just go for 2 hours straight. You know, I got now quite bored. They go for many kilometers at a time, and they come back with all kinds of injuries of the foot, and also yeah.
Yeah, so basically don't be a weekend warrior. If you, I mean, Euro just finished, so now then Wimbledon also finished. So don't think you're suddenly the next superstar hero. Always stretch before and after. And I think it's also maybe a good habit to stretch in between your lessons, or in between your work, you know, in between your webinars, in between your meetings. Make sure you get up, stretch, and, you know, look away from the computer. You know, all these things help not only your body, but like Dr. Sanjiv mentioned, you know, it also helps your mental health, because if you're just focusing solely in one thing that for, you know, non-stop for a few hours, it does get to you after a while, and you might suddenly start developing aches and pains that you never knew what the cause was. So absolutely.
Yeah, Dr. Rakee, so I'd like to encourage our viewers to send us your experience with dealing with the extended lockdown, and what kind of complaints or what kind of medical issues that you're having. Do share with us your experience, and maybe we will definitely address them below with the comments below. Yeah. So in conclusion of our talk, right? So it does occur. Injuries of the hand and the upper back and the neck are the main complaints when it comes to work-related overexposure of online and these methods of using technology, right? And it's 60% of people in the IT sector spend more than 8 hours online. So prevention is better than cure. Our treatment would be avoiding the stimuli, good ergonomatics, right? Having good posture, using technology, using the stretch program. I would encourage people to stretch and discontinue their work every 30 minutes, having good foot rest, right? Maintaining good eye contact, eye level contact, and also preventing our children who are exposed to abnormal time now that we are going through online teaching and numerous hours of teaching. Have a proper workstation, and also this limiting the time for children when absolutely needed. Only then you use different postures and different positions of posture. Yeah, yeah, okay.
Wonderful. I love that whole summary. Excellent.
I'd like to thank you so much for having me on your IGTV, and hope that you
Thank you so much, Dr. Sanjiv.
can follow me and join me on my IGTV too, Instagram. And I'll be having a session later today at 5:30 with Dr. Hardeep Singh from he's an ENT surgeon dealing with COVID and how COVID has affected his work environment. So I'd like to invite everyone to join us around 5:30 on Rampal Surgery IGTV. Yeah, thank you so much, Dr. Rakhee.
So if anybody has, you're most welcome. Thank you so much for joining me live. So if anybody has any personal questions or comments, or just a disclaimer here, we're not giving personal medical advice as doctors. We're giving general information to the public. So please DM Dr. Sanjiv if you have any questions that maybe you have missed, or if you're watching the IGTV or the YouTube channel later and you may want to, and suddenly some questions come about, you can follow Dr. Sanjiv on Rampal Surgery. It's also an Instagram page, so you follow him on there and you'll be able to get all the answers that you need. So thank you so much, Dr. Sanjiv, and I'll see you soon.
Thank you.
Take care. Bye.
Take care.